Okay, students, let's begin another session, and this time I will be explaining how to examine a swelling. Okay, proceeding towards general examination, there are 3 points that you need to keep in mind. You need to know the nutritional status of the patient, the attitude of the patient, and if there is any raised temperature or pulse. Now, raised temperature or pulse will indicate an inflammatory swelling, like an abscess. Nutritional status, like if the patient is emaciated or has lost much of weight, then it indicates a malignant swelling. Attitude of the patient may be deformed if the swelling involves any joint or involves somewhere near the spine, right? Next, talking about the local examination. And inspection. Now there are 7 points that are common, that are very essential in every swelling you need to ask. And the most common points that you will always remember will be the site of the swelling, the size, the shape, and then you proceed towards the surface, the color of the skin over the swelling, edge of the swelling, and number of swellings present. So these 7 points you need to remember. These are not very tough. For everything, whether it's an ulcer or a swelling, you need to know the size, you need to know the shape and the position, and the surface and color. You can have a look at the surface of the swelling. You can comment on the edge whether it is distinct or not, and number of swellings. Right now, the next points that I'll be jotting down here will help you to narrow down your diagnosis to particular swellings, right? And these things are like sometimes pulsation may be seen in a swelling, or peristalsis, movement with respiration, any impulse on coughing, movement on movement on deglutition, or movement with protrusion of tongue, or any pressure effects due to the swelling. Okay, now when I'll be discussing in detail, we will know how to narrow down your diagnosis on these characteristics. Okay, talking about the situation or the site of the swelling. Now, why this is important? Because if the swelling is in midline or in the line of fusion of embryonic processes, the diagnosis will be that of a dermoid cyst. Right, let me show you an image here. So as you can see in these images, here you find a cyst at the position of anterior fontanelle, and here at the fusion of embryonic processes. Okay, like this is the post-auricular dermoid, this is a dermoid at the canthus of the eye. Okay, let's have a closer look of each one of them. Sorry. Yeah. See, this is a postauricular dermoid. Similarly, this is a dermoid cyst in the midline, you can say. It's involving the anterior fontanelle. And this, sorry. Sorry again, sorry. But you can see, it's clear. Sorry. I think I've wasted quite a time showing you these images. Let's proceed further, okay? So the next point will be, after situation and site, it will be color of the surface of the swelling. So again, how color of the surface of swelling can lead you to diagnosis. I will need to show you a few images here again. So as you see a swelling here, how will you define the surface of the swelling here? I mean particularly the color. It's a red, or you can say with a purplish hue, right? So what is this swelling? Any idea? By seeing the very color of the swelling, without any doubt you can say that this is a hemangioma. To be specific, this is a capillary hemangioma. Okay, and now another one. Have a look at the swelling. Now the color is almost black to brown, but if you will be more specific, it's of variegated appearance, right? And this again, and also it is, the shape is irregular type. Now why I'm stressing on this is because such a swelling will be, without any doubt, malignant melanoma. Next we'll be talking about the shape of the swelling. We need to describe the shape of the swelling. Now that can be ovoid or pear shaped, kidney shaped, spherical, or sometimes no defined shape, and you have to say that the swelling has an irregular shape. Now just one thing that you have to keep in mind here is that you have to say swelling is spherical and never circular. Never use the word circular. Why? Because we don't know the deeper dimensions of the swelling during inspection particularly, and even in palpation you cannot have much idea. So you are going to say it is spherical. Right? Again, while talking about the size, you need to mention the size of the swelling in both vertical and horizontal dimensions. And this should be the maximum vertical and horizontal extent of the swelling. Then surface. Comment on the surface. It may be smooth, or sometimes you may feel it's lobulated or papillary type, and sometimes it can be cauliflower shaped. Now what do you mean by cauliflower? What we mean by cauliflower shape, I have an image again here. See this swelling. The surface, how you define this, is very well known as cauliflower shape of the swelling. And what does it signify? A cauliflower shaped swelling signifies that this is undoubtedly squamous cell carcinoma. Okay. Next, you need to comment on the edge. Now, edge can be sometimes distinct and clearly defined, or sometimes it can be indistinct. So the next point is number of swellings present, whether the swelling is solitary or multiple. Now this I have discussed previously too, like some conditions like neurofibromatosis, you will find multiple nodules, right? So now, apart from these points, you have to now come to some specific points which will better aid you in diagnosis and narrow down your diagnosis to specific swellings. Like, you have to see if pulsation is present over a swelling. Now, a pulsation will be seen in a swelling in two conditions. Either it arises from artery, like an aneurysm, or it is in close proximity to the artery, and the pulsations of the artery are transmitted here. Transmitted to this swelling. Now, even here, the type of pulsation felt will be different in case of this and in case of this. When the swelling is arising from an artery, the pulsation felt will be that of an expansile type. And the pulsation felt due to a swelling being in close proximity to an artery, that's known as transmitted pulsation. Now, difference between the two you can do it better when you palpate the swelling. Okay, so I'll be discussing that detail when I'll be discussing about palpation. The next point is about peristalsis. Now, when would you see peristaltic movements with a swelling? So, in a case of congenital hypertrophic pyloric stenosis due to intestinal obstruction, you may be able to see peristaltic movements. Or in any case of intestinal obstruction, you may see visible peristalsis in the abdomen. Next point is movement with respiration. Now, this thing you have to see mainly in swellings in abdomen, and with movement with respiration we mean that with each inspiration the swelling is pushed down due to pushing down of the diaphragm, and with expiration the swelling moves up. Okay, I mean, if this is the abdomen, the movement should be this way and not up and down. And now, for a swelling that moves with respiration, it has to be either arising from liver, spleen, stomach, gallbladder, or hepatic and splenic flexures of the colon. Okay, I think my handwriting is a bit bad, sorry for that. But I hope I'm clear what I'm explaining. The next point which is important is looking for impulse in cuffing. Now, impulse in cuffing will be present whenever the swelling communicates with either the abdominal cavity, the pleural cavity, or spinal canal or cranial cavity. Let's see an example of each type of swelling. When the swelling communicates with abdominal cavity, it's generally hernia, and this is the very much diagnostic fact for a hernia that impulse on cuffing is present. Now, sometimes the swelling communicates with pleural cavity and you see impulse on cuffing, and that happens in case of empyema necessitans. When the pus in the pleural cavity penetrates through the pleura and presents as a subcutaneous swelling. And in a meningocele, again you can find impulse on cuffing because there is communication with the so in meningocele there is communication with the cranial cavity. Now this is either impulse on cuffing, or for children it can be seen in case of crying. Okay, because children won't cough if they are asked to. So if they cry, you can see at that time if the impulse is present or not. Next is movement on deglutition. Now this happens for swellings that are fixed to larynx or trachea. The swellings that show movement with deglutition are a thyroid swelling, thyroglossal cysts or fistula, subhyoid bursitis, and pre or paratracheal lymph nodes. Okay. Needless to say that this test you have to see for mainly swellings that present in the neck. Right. Now how do you do this? How do you test for this? You ask the patient to gulp some water or swallow his own saliva, and then you look for movement of the swelling. If it moves with deglutition, you know what it has to be. Okay. Next is movement with protrusion of tongue. When this happens, you can be very sure that the swelling is thyroglossal cyst or a fistula. And this happens because of relation of thyroglossal tract with foramen cecum that is attached to foramen cecum, and therefore as the tongue moves, the swelling moves upwards. Just look at this figure. This is a thyroglossal cyst. Okay, and the mouth is closed. Now, as the patient protrudes his tongue, you can see the swelling moves upwards, closer to the chin, and therefore this clinches the diagnosis of a thyroglossal cyst or a fistula. Okay. Now let's talk about skin over the swelling. Next thing that you have to notice, the condition of skin over the swelling. Now it can be red and edematous. when you will think that it is an abscess. See, this is the picture of an abscess, and you can very well know that the skin over the swelling is red and inflamed. Basically, whenever there is red, you know there is inflammation going on, and you have to be sure that this is an abscess. Next thing, you can find the skin tense, glossy, and with venous prominence. This is seen mainly in cases of osteosarcoma. Sometimes you see a black punctum over the swelling. Black punctum. What does this denote? Undoubtedly, if you see a black punctum over a swelling, it has to be a sebaceous cyst. Let me show a figure. Can you see this? This is the black punctum, and therefore the swelling is a sebaceous cyst. Right? Sometimes the skin over the swelling may look like peel of an orange. And it's called pure orange. This is seen in malignancy, breast carcinoma. Can you see this dimpling? This dimpling everywhere, making it feel like the peel of an orange. Okay, why does this happen? This happens because of blockage of a small lymphatics that drain the skin. Okay, and this is called pure orange, and this signifies breast carcinoma. Right? Sometimes you can see that a scar is present over a swelling. It mainly signifies that probably the patient has been operated for the same condition before and the swelling has recurred. Right? The last thing that you have to look in inspection is whether the swelling is having any pressure effect. To look for pressure effect, you have to look at limb distal to the swelling. If there is edema of upper limb and there is an axillary swelling, the swelling has to be that of a lymph node. Similarly, sometimes there will be wasting distal to a swelling. This may be due to injury to nerves and leading to disuse of the limb. Okay. Sometimes with swelling in the neck, you may find venous engorgement. And this will suggest that there is retroesternal prolongation of the swelling, particularly in cases of thyroid. You may confirm for retroesternal extension of thyroid by seeing venous engorgement in the neck. So with this we complete the inspection part. Now we will proceed towards things that we have to look for in palpation. Okay. In palpation, we have to consider 15 points. The first 6 will be common for each of the swellings. I mean for every swelling. And those are, first of all, temperature, tenderness, size, shape and extent, the surface of the swelling, the edge and the consistency. The next 3 points are mainly tested in swellings that are cystic and contain fluid, and those tests are fluctuation, fluid thrill and translucency. Now, then other 4 tests include impulse on cuffing, reducibility, compressibility, and pulsatility. And the last 2 points are mainly its testing for fixity to overlying skin, and also its relation with the surrounding structures. Okay, so these 15 points you have to consider in palpation of a swelling. Now let's have a detailed look at each of them. Talking about temperature, first of all, you will see temperature. Now it is best felt by the back of hands, back of fingers, and this may be raised in case of an abscess or well vascularized tumors. Such as a sarcoma. The next point is you have to look for tenderness. Now what is tenderness? Tenderness is pain felt by the patient. Felt by the patient when the clinician, or that means you, when the clinician exerts pressure on the swelling. Now swelling is tender mostly if it is an inflammatory swelling, like an abscess or any other inflammatory swelling. The third point is the size, shape and extent. How you have to comment on shape I have already discussed in the section of inspection. Size, similar to that of an ulcer, you have to mention both in vertical and horizontal dimensions. And similarly, extent also you have to mention both in vertical and horizontal dimensions. Now this has to be with respect to bony landmarks, so that there is no confusion about the extent of the swelling. Okay, now here I'll show you an example. So do you see a swelling here? Now no doubt this is a thyroid swelling, and let me define the margin. Almost the margin seems to be this, right? So how do you define the extent? The vertical extent you can say it's from below the thyroid cartilage up to the sternal notch in vertical dimension, and in horizontal dimensions you can say that it begins from the right sternocleidomastoid muscle up to the midline, right? So in this way you have to explain the extent of a swelling. So why we use bony landmarks? Because when you're presenting a case, your presentation should be such that the person who is listening to you has a very good visualization of the type of swelling you want to convey. So your description should be that precise. Okay. Next point is about the edge. Now edge can be distinct, indistinct, or sometimes irregular. Irregular, whether it's margin or surface, it mainly points towards malignancy. Distinct swellings with a distinct edge are generally neoplastic swellings or chronic inflammatory swellings. And those with indistinct margins are acute inflammatory swellings, like an abscess. Now, while you are palpating the edge of a swelling, here a very important sign comes in consideration, which is slip sign. Now, what is a slip sign? A slip sign will help you differentiate between a cystic swelling and a lipoma. Now look at this figure. It's taken from the book as stars. Now this is a lipoma and this is a cystic swelling filled with fluid. Now what's the difference? When you palpate the edge of a cystic swelling, the edge yields to the pressure. But here the swelling will not yield either, but it is pushed away from the examining finger, and that is known as slip sign, and that tells you that the swelling is a lipoma and not a cyst. Okay. Now after palpating the edge of the swelling, let us see about the consistency of the swelling. So the next point is consistency. Now broadly there are three types. Soft, firm, and hard. Now we were taught, when I was doing my undergraduate, UG, we were taught how to know soft, firm, or hard. We were taught to touch our lips, nose tip, and forehead. These three are of different consistency. Now lips are of soft consistency, nose tip is firm, and forehead is hard. So that you get an idea of what is a soft, what is a firm, and what is a hard swelling, how it feels, right? Now let's see example of each. So example of a soft swelling is a lipoma. Firm swelling is a fibroma, and if the swelling is hard, you have to think of malignancy. Now sometimes you can state that the swelling is cystic, and by that you mean contains fluid, like a chronic abscess. Now, sometimes while feeling for the consistency of the swelling, you may feel crepitus. What is the crepitus? Crepitus is a feeling that when you put your hand over the swelling to feel for the consistency, you will feel like small beads, many small beads beneath the skin, which is nothing but air in the subcutaneous tissue. Okay, so that feeling is known as crepitus, and it is generally seen in surgical emphysema or gas gangrene. If you feel that the swelling is of variable consistency, some places you may feel that the swelling is soft, and some places it may be firm. Variable consistency again points towards malignancy. Now, if a swelling gets molded on pressure, if it gets molded on pressure, it has to be sebaceous cyst or a dermoid cyst or colonic swelling containing fecal mass. By molded, I mean that when you press on these swellings, you may feel that they pit on pressure and give a feeling that they contain some pultaceous material. And these are the type of swellings that can give you this type of feel. After testing for consistency of the swelling, you will proceed towards testing for fluctuation. Sorry. So you test for fluctuation, particularly when you are sure that the swelling is a cystic one. That means it contains fluid. Okay. Now, what's the basis? What's the principle behind a fluctuation test? The principle behind testing for fluctuation is Pascal's law, which states that when pressure is exerted to a fluid, data is transmitted equally in all directions. Equally in all directions. So what happens here is, suppose this is a swelling filled with fluid. What you do is you place two of your fingers on this side. Sorry for the bad drawing, but I hope you understand what I mean to convey. These are your two fingers of one hand, and these are two fingers of other hand. Really sorry for this bad drawing, but okay, yeah. So you hold the swelling from two ends, and now one will act as a watching finger and the other will act as the displacing finger. So what we mean by displacing finger is that when you exert pressure at this end using these two fingers, you feel the thrill. You feel a thrill, or you can say push, at this end, which is felt by your watching fingers. Similarly, simultaneously, this can act as the displacing and this can act as the watching finger. And if you feel a thrill at the other end when you press at this end and you feel a thrill at this end, that is called fluctuation test positive. Okay, Now there are some important points about testing for fluctuation, and that is you have to test for fluctuation in two planes, not in one plane. Okay, always you have to test at right angles to each other. Like if this is a swelling, you test fluctuation at this end, but you also have to test fluctuation at this end too. The test is not complete if you have just tested at one end. Okay, I mean in a single plane. Second thing, for very small swellings, there is Paget's test for this. Now what does Paget's test state? If the swelling is so small that you can just feel with one finger, you put your finger at the center, and if this swelling feels soft at center and firm at periphery, the test is positive for fluctuation. Or if another thing that you may try is, if this is a swelling, you put two fingers of one hand at the two edges of the swelling, which will act as watching fingers. And another finger of another hand will exert pressure at the center, and the thrill will be felt by these two fingers. So these in this two ways you can test fluctuation in small swellings. Okay, now that we have talked about fluctuation, the next thing which we should be talking about is about translucency. And for this, we all know we do the trans illumination test. When you put a torch, preferably in a dark room, where you put a torch on the swelling and look from the other side of the swelling whether it illuminates or not. I mean whether it appears bright red or not. Okay. Trans illumination test, and this will be positive only if the swelling contains water, serum, lymph, plasma, or highly refractile fat. Okay. Similarly, the trans illumination test will be negative if it contains blood or pultaceous material. Pultaceous material like in a sebaceous cyst, and blood may be in a hematoma. Okay, these swellings will give you a negative trans illumination test. The next two important things that we have to look for in a swelling will be impulse on cuffing and reducibility. Now, both of these things are usually seen in a case of hernia. For impulse on cuffing, you just put your finger on the swelling, ask the patient to cuff, and when he cuffs, you can feel the impulse, just that, nothing else. And for reducibility, again, you can try and reduce the swelling, and this is possible only in case of hernia and also in varicocele or meningocele. So these are swellings which are reducible, not always. Like hernia can also be irreducible sometimes, but usually you must look for reducibility in these swellings. So you reduce the swelling, that is the return back to the cavity, and only appear back when the patient coughs or strains. Okay, so these two things are to be looked in. Hernia and reducibility, you can also look in hernia, varicocele, and meningocele. The next thing is about compressibility. Now what happens here is that the swelling can be compressed. We all know what that means, right? Can be compressed, but it will never disappear. Like in case of a hernia, it will just diminish in size and return as soon as the pressure is released. Now, what type of swellings are compressible? These are generally fluid-filled swellings, liquid-filled. Mostly vascular malformations. Now, a vascular malformation can be arterial, capillary, or venous, like a hemangioma or a lymphangioma. Next, we will be talking about pulsatility. Now, there are two types of pulsatile swellings. One is expansile and the other is transmitted pulsation. Now, what is expansile pulsation? Both of these type of pulsations can be differentiated by putting two fingers on the swelling like this. Now, with each pulsation, if your fingers move outward, upward as well as outward, that is an expansile pulsation, which means that the pulsation is directly arising from the swelling itself, and which points towards the swelling being that of a vascular origin. But in case of a transmitted pulsation, when you put two fingers on the swelling, your fingers will just move upward and not outward, and which signifies that your swelling is transmitting the pulsation. That means it lies over a vessel which is transmitting the pulsation, and actually the pulsation is not arising from the swelling. That's the difference. So after you look for pulsatility in the swelling, you have to look for fixity of the overlying skin. Next, talking about fixity of the skin. Fixity of the overlying skin to the swelling. Now, how do you test for fixity of a skin? What you do is you will pinch the skin or slide the skin over the swelling, and you can see that you cannot pinch the skin if the skin is fixed to the swelling, and this may be seen in cases of papilloma, epithelioma, or sebaceous cyst because these arise from the skin. Okay, so the next test will be fixity with the underlying structures. Testing for fixity to the underlying structures. Now, when you test for this, you test whether the swelling is fixed to the muscle, lies above it or deep to it. How do you do that? Let's see. What you will do is you have to make the muscle taut over which the swelling lies. Okay? And how do you do that? You do that by asking the person to perform the action which is caused by the muscle against resistance. Like if the swelling is over biceps, you will ask the patient to flex against resistance. This will make the biceps taut. Okay, and now what you have to see. Three conditions may arise here. The swelling is still prominent, or the swelling may diminish in size, or swelling disappears. If the swelling becomes more prominent than before, you must infer that the swelling lies in the subcutaneous space, free from the muscle. If the swelling diminishes in size, the swelling is incorporated within the muscle. And if it disappears, the tumor lies deep to the muscle. Right? Now what's left is that you should look for enlargement of regional lymph nodes. Okay? Let's see. You must look for enlargement of regional lymph nodes. Very important. Particularly if you're expecting the swelling to be malignant, this becomes a very important step. Then let's have a look at the role of percussion in swellings. Here you may find a resonant note over a hernia. Due to gaseous contents, of course, and then you can infer that the content of the hernial sac may be the bowels, right? Another important, or you can say particular thing for percussion in a swelling is hydrated thrill. Now this is typically seen in a case of hydrated cyst. Suppose this is the swelling, this is the hydrated cyst or the swelling caused by the hydrated cyst. You put your 3 fingers of the left hand over the swelling, the middle finger, the ring finger and the index finger, right? And now with your right hand you percuss the middle finger. So what happens is when you percuss on the middle finger, you feel thrill in the ring and the index fingers, and that is due to the daughter cysts that strike these 2 fingers while you percuss on this. Now that is typical hydrated thrill. Okay, so we have seen inspection, palpation, percussion. Is there any role of auscultation in examination of swelling? Not much, but again, when you find pulsatile swellings, you may look for bruit in them. Okay. Must also look for movements of nearby joints if they are impaired. And the very last but not the least thing to be seen is examination of any pressure effects due to the swelling. Like if the swelling is pressing over an artery, the distal pulses may be weakened or may be feeble. So you must look for the distal pulses from the swelling so that you can rule out if there is any pressure on the artery or not. If the pressure is on nerves, the muscles supplied by the nerves will show wasting or paresis without any sensory disturbance. Also, in swellings like dermoid cyst, you must look for erosion of bone underlying the swelling. Okay, so that's it. That completes the examination of a swelling. I have discussed it very extensively. Okay, and but it's not that extensive. If you revise it regularly and you make out a checklist for the things you have to look in the swelling, it's not very extensive. It's very simple. With practice, you will remember all the points. Okay, hip, gravity.